The other kind of unique thing about our program is with our work requirement, we are very respectful of a non-traditional student's life outside of school. So you're never going to have a synchronous class session on a Monday through Thursday. You're coming in, it's weekend, and that's actually part of our name is weekend. It's weekend so that people can work and still maintain their family life or whatever other personal lives they have outside of school. So that's a really important part.
Hello, everyone. On today's episode of PTA Plus, we are exploring one of the biggest questions a PTA can ask themselves, and that is to bridge or not to bridge? That is the question. Our guest is at the center of the conversation as the program director at the University of Findlay's Weekend PTA to DPT Bridge Program. She's an associate professor specializing in orthopedics and medical screening, a board-certified orthopedic clinical specialist, and the owner of Live Well Physical Therapy, where she works with everyone from everyday patients to competitive runners. But beyond the credentials, she's passionate about helping PTAs find and define their personal why, guiding them through one of the biggest decisions in their career, and that's transitioning from physical therapist assistant into physical therapy. She makes sure that every student who is taking the steps to enter this program feels supported as both a clinician and as a human being. She's a mother, a runner, a lifelong learner, and someone who knows firsthand the power of bridging your career into something bigger. Please help us welcome Angie Huber to the show, as well as two of her students, Melissa and Amin. I'm so excited for you to hear what they have to say about the Weekend PTA to DPT Bridge Program at the University of Findlay. I'm sure you will find the information in it very valuable. Hello, everyone, and welcome back to another episode of the PTA Plus podcast. I'm Katie Sutton, your host, and today we have not one, not two, but three guests on our show. I am so excited to have Angie, Melissa, and Amin with us today, and all of them are from University of Findlay's PTA to DPT Bridge Program. So thank you all for coming on. I appreciate you sharing your time with me and our audience. We hear a lot about shortages for physical therapists that are coming up. So there's been a few things that have been published in APTA material that talks about the fact that we're going to be running into a shortage of physical therapists here in the future. So I think today's conversation is timely because we're going to be talking about your bridge program. So we have Dr. Huber here, Angie. I will be calling you Angie. I received permission from the professor to call her by her first name during today's show. But you're going to be telling us a little bit about your program from the perspective of an educator. But of course, we also have Melissa and Amin with us, who are going to be giving us the perspective from a student's point of view and a graduate's point of view. And I think that that's a really important take for us to look at as well, so we can kind of see what that flip side looks like, because I'm not in school right now. I don't want to go back to school right now, but I am also in education myself. So I do work with PTA students on a regular basis and clinical instructors. So I think that, again, this is a timely conversation. And my own personal opinion is that why not tap into our current physical therapist assistants to fill this need in the future? And this is a position that I've taken myself for quite some time. I talk about it a lot on the show. Our PTAs are skilled. They are clinicians through and through. They have years, sometimes decades of experience behind them coming into these programs. So to me, it just makes sense that we offer these types of opportunities for more PTAs to move through these types of programs. So I will stop talking because I can talk for a very long time. So without further ado, Angie, Melissa, and Amin, I'm going to have each of you introduce yourself, but why don't we go ahead and start with you, Angie, if you can give us a little breakdown of who you are and what you do.
Sure. My name's Angie Huber. I am the program director for our Weekend PTA to DPT Bridge Program. It's a mouthful, and our traditional program. So we do have an on-site program as well. I've been here at the university since 2015. I'm also a clinician. So I teach the orthopedic content as well as medical screening. And then I also have a cash-based business that I also run because I just can't completely get away from patient care. So just to add a little personal, I am a mother of 4 children, and I am a student as well. As of today is my last day. So I just got my doctor of education, and today is my last day. So yay!
Well
So I can
done.
speak a little bit from a student point, not from the bridge program, but I do understand quite a bit about what students are going through. So that is me in a nutshell, and I'll pass it on.
Okay, great. Melissa, how about you next?
Sure. So I am a third year DPT student, and I'm actually in my second of 3 clinical rotations. And I've been a PTA prior to this. I was a PTA for about 8 years prior to starting the Bridge program.
Wonderful, thank you. And I hope all is going well in your clinical. Clinical education is my bread and butter, so it's near and dear to my heart when I hear students say, "Well, I'm in my clinical experience," because secretly we're all hoping that you fall in love with everything that you're doing, and we're cheering you on. So good luck with everything.
Thank you.
Amin, next.
Sure, thank you. My name is Amin. I am a physical therapist. I did just recently graduate from the Findlay Bridge Program in December. I live in the Metro Detroit area and I work in hospital based outpatient at Henry Ford Health. I had been a PTA about 2 going on 3 years prior to entering, and then by the time I had graduated, had been a PTA for 5 years at that point. So 5 years PTA so far, 6 months now as a PT.
Wonderful. Congratulations on your graduation and licensure, and you're out working in the field as a doctor of physical therapy now, right?
Yes, thank you. Yep.
Yeah. So, Melissa and Amin, I can relate to you in the fact that I am also a PTA, and it's really. I always say, if I had $1 for every time somebody said, "When are you going to be a real physical therapist?" or "When are you going to be done with your schooling so you can be a real therapist?" It's so funny that we get that a lot in the field. So, congrats, Amin, on being a real a real physical therapist now. So,
Thank you. But we're all real clinicians, all of us.
yes, yes. I do say that a little bit on the joking side, but congrats. Yes. All right. So we'll just dive right into some questions. I have a bunch of questions for all of you, but my first question is for our students here. So maybe this would be a question for Amin first, and then Melissa, if you would like to follow up. But when was it that you personally decided that it was time for you to pursue a DPT as working as a physical therapist assistant? Was there like a moment that you were like, this is what I know I want to do?
I can't say for me that there was a definite moment. I kind of had the inkling of going to the Findlay program, even in the PTA program. One of my professors was a Findlay graduate who was a PTA and then turned DPT, came back and taught the program that I was in the PTA program. So he was like a constant source there for questions to ask him about possibly transitioning one day. Um, so I had graduated the PTA program, had done most of the prerequisites, but just continued doing the remainder, got the bachelor's. It wasn't clear cut at any point that I said, okay, I'm going to for sure do it. It was just kind of step by step. This is kind of the direction I'm going. Unless something stops me, let me just keep going.
Great. Melissa, how about you?
It was over a period of time. I work with, as a PTA, I was working with geriatric patients in their homes, and recognizing the lack of information that I knew, I felt like I wasn't able to provide the patients with everything they needed, or more. And when I finally acknowledged that and realized, man, I really need to dive a lot deeper. This was, going back to school and getting my doctorate. Of course, it's entry level, and I'm going to have so much more to learn beyond this. But it's a step in the right direction for being able to pursue my passion.
Yeah, I always tell students when they're getting ready to graduate from our PTA program is that the next year after graduation, you learn so much information. Like it's kind of like when I think things just start to kind of come together and you start to feel comfortable and confident in who you are as a clinician. And sometimes they get a little bit like frustrated with me. Like, what do you mean I have more to go? Like, I've been in this program for so long and I'm just ready to get out there. But to me, I feel like that first year after graduation, things really start to solidify. And maybe both of you noticed that as well, that it was starting to kind of point you in the direction of, I know I want more, or I'm completely happy with where I'm at. But I think that year after graduation, you just kind of start to gain some clarity, I suppose, in who you are as a clinician.
Yeah, you know what, Katie, I just have to respond to that because even when you graduate the DPT, it's no different. Whether you're graduating PTA or DPT, you go out into the field and there's going to be a little bit of that imposter syndrome or lack of confidence in all of your knowledge. And I don't necessarily think that a lack of confidence is a bad thing. And we talk to our students a lot about if you don't know something, that doesn't make you any less. That means that you're a lifelong learner and want to know more. And so I think whether you graduate and do PTA and stay PTA or you come and you do DPT, it's so important to really understand that we don't know everything and we're constantly learning. And that's what type of profession we are. And I do think some students that do come to our program, it's because they recognize they do love learning and they do want to keep learning. And they have the grit to do it. So you think of like, I mean, your story, it's like, yeah, it was just like the path that kept going, right? Because you have a grit to keep working hard and you want to know more. And Melissa, with your story, and hopefully you talk a little bit about your future endeavors because you've got some cool stories to share too. There was more you were seeking because you were out there working, knowing there was so much knowledge that we can gain. And that makes, I think, a really good student and clinician, right? A graduate or a student.
Constantly seeking new knowledge, right?
Yeah.
And that can come in many different forms. And I always like to kind of preface this type of conversation about transitioning to
Mhm.
DPT is, I mean, this community that listens to PTA Plus is primarily physical therapist assistants, right? So I'm sure that there are some physical therapists that listen to the show. But for the most part, it's all directed towards PTAs. And I always like to say, like, this isn't the path for everybody, but
Right.
it is quite possible that it's a path for someone that
Yeah.
might be interested in doing this. And there's no right or wrong way to get it done, right? So the traditional program, if you want to go that route, totally fine. If you want to do the bridge route, totally fine as well. If you don't want to do it at all, I mean, I have my bachelor's degree, master's degree, and neither one of them are in physical therapy. So, I kept going as well. Again, that natural progression, like Amin was talking about, I just wanted to learn more, but I knew I was happy and content as being a
Mhm.
PTA. So there's nothing wrong with whatever route we choose to do. Now, Angie, what about you? Is there like a common theme that you might hear from students on why they decided to transition?
Um, there are themes. Every student is definitely different, right? And speaking to what you're just saying about it's okay to do any route, that's absolutely sure. There's no one there to tell you this is what you should do. You have to decide yourself what is meaningful to you, and where is whatever choice you make, where's that going to lead you, and is it making you happy, and are you able to serve the people you hope to serve? The students that I see, and we do an activity when they first come in is like, what is your why? A lot of them are advancing in their job, right? Some people want to start their own business. Some students want to get into education. But then there's also a lot of students who they want that autonomy that they didn't have. And I say students, remember they're in the program at this point. So it's PTAs, they had their reason before they were students. But the other thing, beyond anything professional, that I've seen that I guess I wasn't expecting was even things like I want my daughter to see that I can achieve this. I want to show somebody in my life that I can make this happen and I want to make this happen. I want my doctorate. So everyone has personal reasons. I think it's important you know your reason and that you're not just going into it blindly because it is really hard work,
Yeah,
right?
that's a good point. Yeah, definitely. I mean, this isn't something that you decide to do and start tomorrow. There's a lot of
Yeah.
preparation before you get there, a lot of time and energy that's committed to this, as Melissa and Amin are well aware, right? So, Angie, if you don't mind, could you tell us what do you think, since there are so many different paths to
Sure.
becoming a physical therapist, but what would you say makes a bridge program, specifically the one at University of Findlay, unique for PTAs to come in?
Sure. I think one of the big components of our program that's unique is it's all PTAs, right? Everybody you come into and meet within the program that you're going to learn with our PTAs, and you're with students from all over the country, and so you get this really um, beautiful diversity of geography and experiences that you're going to learn from. The other unique aspect about bridging, that kind of term bridge, because we get that a lot. Well, you're still getting a bachelor's degree, you're still getting a doctorate degree. So, what do you mean by bridge? There's that planned curriculum that we have in a program where you go through so many courses and you get a degree. But there's also kind of that hidden curriculum or that extra curriculum where you're taking what you learn from a day to day in our classroom and you're using it the next day in your work environment, because our program requires you to work and apply. So I had one graduate say it's like I go to a CEU course, like a really intense CEU course, and then I get 2 weeks to like put it into knowledge in the clinic. Some of it I can do physically as a PTA, some I can't, but I can reflect on it and use my thought processes, enhance my clinical reasoning in between. The other kind of unique thing about our program is with our work requirement, we are very respectful of a non traditional student's life outside of school. So you're never going to have a synchronous class session on a Monday through Thursday. You're coming in, it's weekend, and that's actually part of our name is weekend. It's weekend so that people can work and still maintain their family life or whatever other personal lives they have outside of school. So that's a really important part. And then lastly, I would say the bridge. There's actually a course we have in the very start of the program called Competencies, and it's a pass fail course. And students come in and they show their PTA competencies in a very expedited process. And then as we move into more challenging coursework, we can challenge these students more than traditional students at a higher level of learning in their first year, because we have that expectation that you already know, say, for example, how to do your goniometric measures.
Mm-hmm.
So that's just one quick example. There's a lot of concepts you learn in PTA. We know what you know. We expect you to still know it, and we're going to take it to the next level fast. So that's that bridge component too.
Very interesting. So you have to have like a very broad brush approach though, because you can have PTAs coming in from various different backgrounds and settings, right? So
Yeah.
what does that look like? Because you might have somebody who's like primarily worked in outpatient orthopedics and somebody who worked in neuro,
Yeah.
and then you're trying to do those competencies. What's that like? I
Yeah.
picture mass chaos, but
Yeah, usually the competencies everybody seems to do really well in. It's a psychomotor skill. It's when we start to get those students into, say, their neuro class, where there's a lot of clinical reasoning, assessment, evaluation components, that you really start to see that difference. And so we have a very supportive faculty. There's actually a few faculty that are alumni of our program that have a really good understanding of what that baseline, even not necessarily what skills they have, but what level of knowledge they have. And so we may end up meeting more with that student. We do help students recognize, like, hey, neuro, that's going to be tough for you. Your ortho, you're going to fly through. So you're going to have to balance that. Ortho, you're flying through. Maybe you're a little less time intensive on that. Your neuro, you need to meet with us more. We need to have a little bit more intervention to help you get through that. But in the end, all the students come out very successful. And I think what's kind of cool about the fact that they're all in a different place is that they start to recognize where they're weak, because they're with clinicians that are really strong in another area. And they're like, wow, I thought I knew what I needed to know. But like, how do you know all of that already? So it's a very, I don't know, fun environment for me to teach in, because there's so many clinical conversations and discussions that happen because of that variety.
I bet it's a really rich atmosphere with
It is.
knowledge and sharing of details and information and stories and whatnot. Melissa, what type of PTA do you think would be a good fit for this type of program or thrive in this type of program?
Someone who is absolutely passionate about treating patients. And in my opinion, obviously we all need to make an income because we have bills to pay, but at least for me personally, I was at the point where I was like, I would do this for free. Like, I love treating patients so much, and I see such a need for it in our society that I would do this for free. And that, for me, when I get my mind set on something, and I think this is a good attribute to have, especially for this program, is grit. You set a goal, and there are obviously quite a few challenges that you're going to run into, but it's keeping your focus on that goal. And Dr. Huber had us reminded us of this several times throughout the program. Remember your why. And so circling back to that and remembering your why, and especially those times when, man, you don't want to give up, but you're kind of teetering, getting close to that line where it's like, where's my limit? And you just keep raising the bar. And so definitely a student who is extremely passionate about PT and just wants to be that lifelong learner and always advancing, their skills, and definitely having a lot of determination and willpower and
Grit. All
discipline.
about grit, right?
Sorry.
Yeah.
Discipline is like the ultimate, in my opinion, the
Yeah,
ultimate attribute to have.
for a program like this, definitely. And I think that sometimes we forget how hard PTA school is. Like Amin and Melissa, you can probably recall not that long ago going through PTA school in less than 2 years, how much information we have to learn. So I always try to make sure that students who are entering in understand the amount of time and studying that goes into these types of programs. It's not, it's rewarding, and you can have all of the things that Melissa loves about her job, but you definitely have to put the work in to make sure that you can get there. I mean, I have a question for you in regards to identity, because when you're shifting or transitioning from PTA to DPT, there is a little bit of an identity shift there, right? So how did that feel for you? And was there a moment that you were like, okay, that's it. I really feel like I'm a PT now?
I definitely think it happens in the evaluation room. I think when you're out, when you get your first job as a PT and you start getting evals on your caseload, I feel like that's when it happened for me. It's one thing to perform like mock evaluations with your classmates in the program during your lab practicals in front of the instructors. You're still a student in that setting. Even out in clinical rotations, your CI is not far away. But being on your own for that first evaluation or that first week of doing evals, that's where I noticed that difference.
Yeah,
Was
Melissa.
that like, can I have a question for that? Like, was that
Yeah,
like,
go,
what was
go
that,
ahead.
what did that feel like? I mean, was that exciting? Like, what
Very,
were
yeah.
you
Yeah,
like?
it was the culmination, I'd say, of just putting everything from 3 years into like that one or few evaluations that I did in that first week. It was very exciting.
Angie, do you see any shifts or changes in students while they're in the program, like coming from year one to year three? And then maybe
Oh,
Melissa can tell us what year three feels like compared to year one.
yeah, yeah, definitely. So I used to teach the elements of physical therapy practice, which is the end of the first year. And that's before I became chair. Um, and there was that class, it's elements, right? So you're thinking like, oh, okay, basic evaluation. But when we look at that class, we look at, can you now speak the knowledge? Can you evaluate and pull all of these components together within our ICF model and know what to do with that? You're in charge now. And there's some students like take that and they're like, yes, I'm finally doing all the first year stuff. There's other students who are like, I don't know, right? But then once they move to second year, they're in neuro, they're MS, they're cardio, and this is more specific to the systems. And we start to take those evaluation components and add a diagnosis, right? There are aha moments probably towards the end of those courses. So the end of year two. But then there's a third, like I get to teach the musculoskeletal 3 course, which is a lot of differential diagnosis. And this is where the students who maybe had aha moments in year two with simple cases come in there and like, whoa, like now we got something complex. And there's another aha moment. I think there's just this gradual growth that you see. Part of it's how that's how the curriculum's set up to be. But part of it, I think, is that build up a foundation to build up of clinical reasoning. One of my favorite things, I think, is, and I don't know, like if you have someone who's orthopedic, right? And I kind of said this before, like if you're orthopedic seems easier. Sometimes it's the opposite though. You can have a student come into, say, my musculoskeletal 2 class and like, why work orthopedic? This is going to be easy. And then there's these erroneous beliefs of what is best practice. And they start to learn that that's actually not best practice. I need to change what I'm doing. I need to question my own behavior in the clinic. And that can also be big growth moments.
Hmm.
And those are probably my favorite, actually, because that's when you start to see changes in how people perform in the clinic. And you start to see PTAs and PTs really communicating more because they're not afraid to, like the PTAs aren't as afraid to ask the why to the PTs they're working with because they're growing themselves in confidence, if that makes sense.
Yeah, that
Is
makes
that those are some beautiful changes that I see.
yeah, yeah, that makes a lot of sense. Melissa, how about your take on what it was like to go from year one to year three? Like, what kind of changes do you see in yourself and other students through that transition?
Dr. Huber touched on a lot of it as a lot of confidence and being able to piece things together from each of our fields that we've worked in. I remember a specific practical that I had with Dr. Huber, and I'm just going to admit, um, I felt confident with a lot of it, and then at the end, I realized I missed a major component and I started crying. And I mean, obviously, they're nerves. But the reason I was so upset is because I missed something major. And I thought I put so much pressure on my role as a student, a physical therapist, that I'm going to do my patient harm. But by not recognizing something, now it wasn't life threatening, but it was a significant clinical presentation that I should have recognized. And at that point, like I had put so much pressure on myself in year one. And Dr. Hubert, she just smiled and gave me so much grace. It was like, it's okay. Like you are going to build your confidence with your experience. And of course she was right. And, moving into year 2 and year 3 has each and every patient that you see presents just slightly differently and builds your confidence. And so I definitely I appreciate the progression and how this program is designed to slowly incorporate and advance obviously your clinical skills, going from simple cases and then onto complex cases, but the ability to build your confidence in that way.
I think to Melissa, what you're saying too, and I remember that specific one you're talking about. Um, there's I think something we have to learn as we learn is you have to have self-compassion, meaning you shouldn't beat yourself up when you're learning because you're expected to not know everything because that's going to build you and grow you. So first, giving yourself some grace, right? And then something we talk about a lot as students go through those 3 years is, okay, you're reflecting on the fact that you made a mistake. As you get better and you do this over and over, you're going to reflect at the moment it's happening and catch that because you're reflecting within the action. And that's how you become an expert. You reflect at the moment. I'm really probably annoying about the word reflection. You guys hear that a lot from
I
me
talk about it a lot
in
too.
my notes to Katie before, because I think it's all about improving as a person and clinician as you go through that learning process too. So having compassion, having grace for yourself, realizing you're now reflecting on what you could have done better, but as you grow, you reflect in the moment and those mistakes won't happen as often.
Yeah, and I think this goes back to some research that I've done on clinical reasoning and clinical problem solving. Is, as that expert clinician, you have the ability to kind of filter through some of that
Mhm.
stuff. But when you're a brand new, fresh clinician, or you're in a stressful situation like you had spoke to, Melissa, it's harder for you to see that whole picture versus seeing like a list of tasks.
Mhm.
So you just kind of check those things off, and it's hard to like see the patient through that because you're like worried about all these like tasks and things that are going. But then that expert clinician, like they just look like they're superheroes that can just do all these different things and just know what's happening and can see things in the back of their head. But it's really just a matter of that continual practice, and that they've got that skill that they can filter through and delineate what's important and what's not important, urgent and non-urgent, quicker than what we can as a fresh brand new clinician when we're trying to think through all that stuff. So I appreciate you sharing your story on that, Melissa, because I think it's important to realize that we're all going to have those moments where we misstep or we have a bump in the road, and it's going to be fine as long as we're learning from that mistake, right? So I think it would be probably more often than not that students forget something along the way versus us remembering everything all the time. That also was true for me when I started doing this podcast. I mean, I'm not a podcaster by background. So, me learning all the tips and tricks and hints to how to keep these things rolling, I had no idea what I was doing. I just started doing it and just kind of like figured I would learn as I go. But there was a lot of mistakes along the way that I was like, oh, if I would have known, I wouldn't have done it that way. Or I knew that and I still did it. I'm not going to do it the next time. And I'm going to stop saying, and I have not conquered that one yet. Hopefully in the future.
It's the
Well,
same thing as a teacher too. Like we always ask for feedback from our students. Like, that's so important. Like my perception might be this class went great. I loved everything we did. I bet they learned everything. And then you ask for feedback and like, please give me constructive feedback. And you realize the perception on the student side was like, meh,
didn't quite good.
like let's do it this way instead, or this is what I need instead. It's like, okay, that it's just a constant, like you mold and you change and you get your feedback, and that's with any job, whatever you're doing. And that's with the PTA too. Like if you don't go back to school, you're working in a clinic. And if you have a situation, you learn from it. And then you're better the next time.
Feedback is so valuable. And as an instructor, I understand what you're saying, Angie. When you're so, you kind of have to be in that right mindset. You're like, okay, I'm going to look at my evaluations from the students and get yourself ready to go. Because like you said, sometimes you're like, man, that class went really great this semester. And then you're like, oh man, there was a lot of things that I can improve upon. Or you're like, man, I just didn't feel that class. It wasn't good. And the students are like, it was great. It did. And you're like, oh, okay. So
Okay, that's all right.
yeah, we're learning and changing every day, right? So, for the PTAs who are listening today and are thinking about applying to either University of Findlay's DPT, or I'm sorry, PTA to DPT Bridge Program, or potentially another one, because there are several bridge programs out there now, what do you think that they can do to kind of set themselves up for their best success? And Angie, I'll start with you, but I'd really like to hear from Melissa and Amin on this one too.
Okay. I'll give you the more like those technical things, right?
Okay.
And of course, all programs have different admission requirements. So I can give you ours, but if ours are a little different than others, the biggest thing is getting onto their sites and saying like, what are the requirements? And also realizing, depending on where you are in your experience, you may have more requirements to do before you can even apply than somebody else. So, given an example, we have students that come in who have their PTA and have never gotten a bachelor's. And then, so they're going to take 2-3 years to get that bachelor's and the prereqs. So look what the prerequisites are. You're going to need to get a bachelor's degree, get those taken care of. There are students that have a different situation. Maybe they did go to school and got a bachelor's degree, but changed career choices or for some reason went to PTA. So then you have to make sure like what is going to transfer over for prerequisites. And the bachelor's degree, great, you got that down. So bachelor's degree, find out if you have the prerequisites. If you don't have them, get them. Look also at some requirements for prereqs specifically. There's always going to be a GPA cutoff.
Mhm.
Usually admissions, so for example, ours, we have a 3.0 GPA, like overall GPA. That includes your PTA classes, that includes any other classes you've taken in any college. And then there's the 3.2, which is our prerequisites. That's your math, your sciences. And that GPA is different. And sometimes students or applicants don't see that difference. So make sure you're understanding what those GPA requirements are for the math and science courses. Now, for setting up successfully outside of class or outside of coursework, I definitely recommend getting involved in your professional organization. It's really important when we look at our admissions that the students coming in, they value the profession of physical therapy. So being an APTA member, being a member of your state, having some leadership within your own work environment or within any professional organization or community organization shows us that you have some of those skills already, those leadership and communication skills, and that you value our profession. Not everyone has scholarship coming in, but if you do have any scholarship or you've done CEUs for your company, make sure you highlight those. We do ask you to put a resume in your application. It's amazing how many things are left out of the resume that would highlight you. Include it all. Like you're doing a resume not for you don't need a 1-page resume. Like put it all in there. Like you did service at your church, put it in there because we're looking for well-rounded people. The other thing I would recommend, and this is again specific to our program because I don't know everyone else's requirements, but we do still require essays. And one of the things we're looking for in our essay is not a chat GPT essay, right? We're looking for examples of your ability to work with different kinds of people. We're looking at your ability to be prepared to start the program. So those are some things to consider. How can I show that I'm ready to take this on and that I'm a well-rounded person? So that would be some tips I would say as you're preparing.
I love that you mentioned the part about the resume. I check all of our students' resumes before they graduate, and I'm always telling them, like, you've left out a huge amount of information about who you are. I'm like, don't forget to put all of the volunteer things that you did, and don't forget to put that you're an APTA and an Ohio Physical Therapy Association member, and don't forget to put in where you volunteered and your service in the PTA club. And sometimes they think, well, these are just things that I'm supposed to do. And I'm like, but it means something. So
Yes.
definitely, it's hard to brag on ourselves, but it's not viewed as bragging. It's viewed as demonstrating your abilities to lead and your abilities to work with other individuals and things like that. So
Yeah, because we're not looking at the graphics of your resume to be succinct. We're looking at we want to know everything you've done.
yeah,
Absolutely.
yeah. So include all of that good stuff. I
Mhm.
mean, what would you say would be some ways to kind of set yourself up for success?
For the PTAs that are interested in possibly pursuing Findlay or any kind of bridge program going forward, those that don't have a bachelor's degree, and I can speak from that because I didn't have one before going into the PTA program. Some students do, others don't. I would say check the college university that you graduated from and see if there is any kind of 3+1 agreements for transferring to get a bachelor's degree. That saved me, I can say, so much time and it saved me a lot of money on getting a bachelor degree. My degree ended up being still in the field of PTA. This university just took my associate in applied science and just turned into a bachelor's. And I was able to do it in 10 months. And that was huge for me because that means I could have applied to Findlay, when I did. Had it been a university that I would have needed 60 credits, for example, that would have just taken longer, more money, more time while I was working as a PTA. So, and Dr. Huber can clarify for this, but I don't think Findlay is picky when it comes to which bachelor degree you have. I have one in the field of physical therapy. Some have them in biology, some in exercise science. So it's important to shop around for if you are going to that bachelor step in order to get and apply to the Findlay program.
Yeah, and I mean you're absolutely correct. It doesn't matter with the bachelor's, which can sound kind of funny. It's like, what do I have to have like an exercise science bachelor's or a PPT? Now, if you get those bachelor's, the nice part is the prereqs are usually built into it because it's prepping you
Mhm.
for PT. But if you're doing PTA and then getting your degree, that may not be necessary, especially if you have an interest. Like right now, we're looking at degree completions at Findlay for business because we have so many students wanting to do business. So, a bachelor's requirement, and why we have that is because you need to have enough 300 and 400 level coursework under your belt to be considered ready to jump into 500 level plus, right? So if you come in, I've had people come in with the one was a dance major, but then she went and did all of the prerequisites. She was a fantastic student, but she had dance in her history and she's going to be a dance PT right now.
Mm.
Like, we didn't look at that and say, oh, she's not qualified because it's a dance bachelor's. It doesn't matter.
Yeah, that's a great suggestion there. I mean,
Yeah.
Melissa, how about you? What do you think sets somebody up for success?
Well, I want to touch on the different types of degrees because I actually finished my bachelor's 20 years ago now, and my degree is in natural resource management. So definitely another unrelated degree, but I put forth the time and effort to take all the prereqs, which were required for my PTA program, but then of course, additional were required for this bridge program. I would say outside of, the requirements to get in, one of the biggest things is your support system and having that lined up. Um, for me, it was my family and my two kids. I needed to know that no matter what, my husband was going to be behind me and not falter. And so knowing that I had that support is what a lot of what got me through the program. So being able to, be at a point in your life where the people around you are going to help support you achieve your goal is absolutely necessary. So, of course, add all the requirements getting into the program, but just knowing that your support system is there is going to help you be a lot more confident going into it.
Yeah, and Melissa, do you remember at orientation when you started? We had a conversation, you and another student, about taking a weekend off because of it was something to do with your child. Was it a graduation?
Her high school
Yes.
graduation.
And I mean, you were planning like, was it 2 years ahead,
Yeah,
maybe?
it was 2 years.
Yeah. And I was like, oh, yeah, because you do want to make sure if you like, we aren't asking our students to give up their lives, right? These
Mhm.
are non-traditional students, meaning like the age range is like 1 year after PTA degree, all the way to 35 years after PTA degree.
Hmm.
That's a huge variety in what their lives look like outside.
Yeah.
So what Melissa's saying about preparing for the support system, understanding your needs, and making sure that that's going to work out within that program is important because you've got to keep your mental health good. You have to keep your taking care of yourself. That's a priority that you should have through the program.
Yeah, that's something that I try to encourage with my students as well in the PTA program. If we have a break, I make them get out of their seats. I'm like, go. You're not allowed to stay in your seat any longer. If you want to scroll on your phone, that's fine, but go somewhere else. And so I kick them out of the classroom because we tend to not take care of ourselves. Let me put it
Yeah,
that way
it's
when we're
true.
so busy in these types of programs. So it's important for us to kind of bring students back to remember you're still human. Remember you still have people in your life that need attention as well. So it's a little bit hard to do that balance sometimes, but we all get it done. And in the end, everybody seems to say it's worth it. So we just gotta, what was it? Grit, Melissa? Is that what you were saying? We need that grit to get through it. So something that has been a theme so far is this community feel, right? So University of Findlay is really setting up their students for success by putting them in these cohorts of other PTAs, right? So what was it like, or what is it like with that power of learning alongside of other PTAs? So Melissa, I'll let you kind of touch on that first, and then I mean, if we can get your opinion on that as well, that'd be great.
Okay. So we kind of already touched on this earlier as far as for talking about the age range of the different PTAs, their years of experience, and all the different fields that we've worked in. I will say, each of us respected each other in our level of experience. And not just that, but a huge part of it is, and I'm going to mention family a lot, because a lot of us are middle aged and have families. And anytime that a family member had an incident, had to go to the hospital, I mean, a number of things, could happen. The entire cohort would rally together and, do whatever we could to support that person. And that supporting your mental health in that way with that support system, as well as your family support system, but your school cohort was extremely helpful.
Yeah, that sounds like it. Amin, how about you?
That actually brings up a funny story that we had in our cohort. One of my buddies, in the first year, he and his wife welcomed twins
Oh my.
in the first year of the program. And so the entire class chipped in, and, we set up like a donations thing, and we bought him and his wife, I mean, the essentials, like um, baby diapers, baby food. Like we just compiled it all in this box and gave it to him one day, I think during Dr. Huber's elements class. And so it was instances like that you grow close to your classmates, because you're spending so much time with them during these weekends that you're on campus. You get to know them, you get to know their backgrounds. Um, like Melissa said, anytime that somebody in the program or a family member suffered an illness or had an accident, the entire class would rally behind them and show their support.
Yeah, that's also something that I think you do see that in your PTA programs as well. But 3 years of that really intense weekend program, I'm sure that you're building these connections for to last a long time after that. Now, I mean, would you say that's true that you still maybe stay in touch with some folks now that you're graduated and out doing your PT thing?
Absolutely. I have one friend coming up next week, he and his wife, and another one, and we're going to go to up north, northern Michigan. I try to keep in touch with as many of them as I can. So, yeah, absolutely. They are lifelong friends.
Definitely. Weddings, babies, all the stuff, right?
I can tell you that it was the class before you. I may have the number wrong, but it was a lot. Like, I'm pretty sure there were 6 newborn babies in that cohort. And it was in my third year MS3 course. We had like a 2 hour baby shower because we had multiple pregnancies coming up. And I think that's kind of the cool part about this program too, is that is a kind of just expected. It's not like, oh, is it going to work out if like this happens to my family or this happens? Yes, like please keep living your life and let's celebrate it. And it's so fun. I think you had different gifts than what you said on that baby shower too, by the way.
What else did we have?
I
I
feel like
know
there was a big bottle of liquor that came.
there was some of that too for him. Yeah, absolutely.
That makes sense, right? Twins and a DPT program. We get it.
Not drank on campus, just
Yes,
No,
of course not. No, we
given
don't
wrapped.
encourage that. No. Yes, take that home with you. So becoming a DPT requires a lot of growth and a lot of reflection, at least I think. And Angie, you're a big fan of the word reflection and self-reflection, right? We've talked about that. How did you identify different professional and personal growths through the program and work on them? So, Amin, I'll let you go first and answer that question, and then we'll switch over to you, Melissa.
as far as professional gaps, I mean, I think everybody came into the program with their strengths and their weaknesses, and it was a matter of identifying. And I think the curriculum helps you do this quite quickly, is identifying your weaknesses and making sure that you pull up those good study habits that you used in the PTA program, and um, try to hammer in those topics so that you become competent in them enough to pass the exams, pass your competencies. And then we often would ask our classmates, those that say, like, if we were dealing with something, I was dealing with something neuro related, and I'm primarily orthopedic in what I practice. I would go to my classmates that are experts in neuro or have been doing it for years and ask them their take on how do they approach this? How do they understand this concept? Because I haven't been able to understand this concept for years. I struggled with it in the PTA program, and here it is again in the PT program. So doing things like that.
Melissa, would you give us your take?
I'm going to agree 100% with Amin here, and reflecting, especially after any assessment, or even doing assignments, like getting the feedback from professors was huge, very, very helpful. And so after recognizing that and going, as Amin said, going to other classmates who are experienced in whatever topic, whatever concept that was that we knew we were deficit in, was that's something that was really helpful. And not just classmates, but even going back and talking with professors on specific subjects that we were doing. That was they were always open to meeting with us and setting up a time to discuss certain things that we struggled with, and that was
I
helpful.
can imagine that you have really rich conversations. I know we kind of touched on that earlier, but coming into a program like this, you do bring some experience, and your classmates bring experience. So I always have this exciting moment when the students come back from their first clinical. For me, that's in January, and hearing them talk about all the things that they got to see for the first time. But I am imagining in your classes that you don't have to wait for that first time for students to be able to talk about it, but instead they've already seen some of these things. We might not all have seen them, but someone in that room might have an experience that could tie into whatever that topic is and be able to kind of share it firsthand versus waiting until everybody's had that experience.
Yeah. Oh, I gotta follow up on that, because as an educator in this program, that is by far my favorite thing, is that the discussions we have, like, it's not a scripted classroom, right? I come in, I know which content needs to get covered. I know what needs to be introduced and what level we need to get to, but there's got to be some wiggle room for time, because we do have really, really good conversations. And there's times as an educator that I'm like, okay, this is textbook. What are you seeing? Like, let's have a discussion on what you're seeing. And then sometimes that even gets into ethical conversations. Like, how do we change that in our profession so that maybe what you're seeing could be better? Or then I'm learning because they're telling me about some new surgery that's coming out. I'm like, I've never heard of this.
It happens.
That definitely,
Come back and we've not seen that either. So,
never heard of that before. Let me look that up, and then yeah, we'll get back to that. But that's really exciting. It's a very fun environment. I think you guys would agree with that, I mean, and Melissa, but um, that's probably my favorite reason to teach in that class, because of those conversations. And I think we're probably 50 to 60% of our faculty still practice in the clinic. And so we can bring situations forward, to have conversations over real life, problems that we're seeing, which is also really fun.
so I'd really love to have all of your opinion on this one. This is a topic that I talk a lot about on the show, is the PT-PTA relationship. It's definitely something that we talk about a lot in education as well. I think as a PTA, we automatically are kind of bathed in that PT-PTA relationship because everything we do is reliant on following the PT's plan of care, right? So we're kind of like already embedded into that role a lot. I think it's becoming a little bit easier for DPT programs to infuse the PTA into the team, the role, things like that. I think we're kind of moving in that direction. But as a PTA who's transitioning to a DPT, how would you say your view of that team has changed, or has it changed? So I'm gonna start with a mean on this one because you've been out practicing for a little bit now. So let's get your take first.
I definitely think it strengthened it. I mean, if anything, I knew as a PTA what the role was, and but going through the DPT program, and then coming out as a DPT, I think that I think that I appreciate the relationship even further, even more. I always look for the PTAs that I'm currently working with. I always look for their feedback. Yes, I'm establishing the plan of care now. A lot of times they're the ones that are executing it. They may get a patient that I have that I evaluated just because um, of scheduling issues and I may be off and they're seeing that patient for majority of the time. I look for their feedback. I find them and ask them, how can we progress them even further? What are you seeing? And things like that. Um, so I think going through this program strengthened my view of this collaborative uh, relationship that PTs and PTAs have.
Great. Melissa, what do you think? I know you're still in that third year, but I'm sure you have an opinion.
I do. Thanks for asking.
Mhm.
I'm actually in that transition. We just did our mid clinical evaluations or assessments. And one thing that I am struggling with is transitioning my mindset of being in a supervisory role of PTAs. And I mean, I work very cohesively with them, and I ask for their input and I ask them, well, why are you doing this? Like, and they'll do the same thing. We'll have that conversation back and forth. But I'm struggling with, and I don't, not the respect aspect of it, but just understanding my role as still a student, but in a supervisory position is, I am not quite there yet. I'll just say that. I know I will be, but I definitely need a little bit more experience with that.
You'll get there. I have no doubt. Angie, what do you think about this question? Because you're going to view it differently. You're seeing it from a different perspective.
Yeah. So, I started practicing in 2008. So I've had the PT to PTA relationship. And I've had really beautiful PTA to PT relationships. And then I've had some that I've had to work harder to make that relationship strong and improve that communication. And I think probably the most important thing from both sides, the PTA and the PTA, in my opinion, is that both sides need to be curious. If you're a PT, you're the supervisor, you are coming up with a plan, but you need to be curious that what you've done is effective, and you should be curious to see what your PTA has to say about the treatment sessions. When you're a PTA, you need to be curious to understand the why behind why that PT is just prescribing what they're prescribing, because as your understanding gets stronger, you become a better PTA. And I say the word curious instead of like, some people are very defensive. I've seen the PT and DPT relationship that there's some defensiveness. If someone says, why did you do that? It can be defensive to that person, specifically if they're kind of built in a more defensive, they're kind of already starting out in that mode. But if you're saying, I'm curious, can you explain to me?
Yeah, that
That's a
word
different
changes it.
conversation. And so I think like if a PT and a DPT, sorry, PTA and a DPT, they want to make their relationship strong, just keep being curious of each other, and that's going to help build it. I've seen really, really beautiful relationships from our PTA to DPT students with their PTs, and they grow so much, or at least they tell me they're growing. Like I'm not seeing them in the day to day work, but they're telling me the stories of how their like work life, they're getting this new passion because they're having such beautiful conversations. Um, so that curiosity, I think, is key.
I like that. I use that word a lot myself. I always like to say I'm genuinely curious because if you say I want to know, it might feel like you got to tell me, but curiosity is different. You can approach it a lot more gently, to hear when someone says, I'm curious. I'm curious to know your thoughts.
Yeah.
Yeah, so I like that word. We're going to stick with it. Okay, so I'm going to go around. We're going to do around the squares. I don't have a table here, but so for someone who's listening to the podcast today who isn't sure if this is right for them, but is still thinking about it, what kind of questions should they ask themselves before they decide to make the leap? And so I'm going to start with Melissa first, then Amin, and then Angie will take your thought last.
That's a loaded question. Um, um, I think there's just so many different aspects. A big one is the discipline. Are you at a point in your life where when things are hard, you will continue to push through? Do you have a support system? Do you have the, are you at a point in your life, sometimes financially, to be able to, with school loans, of course, a lot of people use those, but as far as for your family, are you at a point where you can take that, pay cut working part time as a PTA while you're in school? And I think those are the aspects, the biggest aspects that were important to me when I was considering the bridge program.
Yeah, good information. I mean, what do you think?
Definitely, those are huge aspects that Melissa mentioned. Having that motivation, that mentality of being that lifelong learner, I think is huge if you want to pursue that doctorate degree. Um, Being disciplined, having time management skills. I still go back to the PTA program that I graduated from and will tell the outgoing second year students, I'll talk to them about Findlay. And time management is a big thing that I mention to them if they are considering Findlay to definitely make sure that they're strong in that area. And the PTA program too, that I mean that's something that even in the PTA program we had to definitely be strong with time management and organization. But for a program where you're working, you're required to work the 40 hours per month, you're traveling, some people are flying in, making sure that you prioritize study time here, family time here, and staying on top of that, I think is important if you're considering this program.
Great suggestions. Angie.
They hit it good. I was writing notes what you were saying. But I think the one thing I would just add, and I guess this is just repeating, I mean, that you do need to work 10 hours a week in the program because that's part of your curriculum. So it's important to know that you're in a situation you can do that. And then my other thing was, is it a time in your life that works? I think that really speaks to really what I mean and Melissa was saying too about, knowing that you have the time to do it. But I think probably the more important thing is like, is this something that is important to you? Right? Practice is changing. I love that companies are supporting students to do this now, or PTAs to go back and get their DPT. I think it's great that you can make more money as a DPT. There's professional financial business reasons to do this, but it also I think is really important that it's important to you. There's got to be some passion for wanting to do this versus just maybe important to someone else saying you should go do this. So that would be my other suggestion because I think the grit, I think the time management, the keeping yourself healthy, all those things that will happen, and you will find ways to do that if it's something that's important to you. And at least it's a lot easier to do those things. So that would be my last advice, I guess.
Great. Good. Okay. So, Angie, I'm going to have you give us your plus points. So this is our tradition on how we always end the show is with a plus point. So this is where you can like call to action, grassroots effort. You can get on a soapbox, whatever you want to leave the audience with. But I'm going to have you go first and tell us like, what's your powerful message that you want to leave for the audience today?
Ooh, I hope this is okay, but I'm putting a plug in for University of Findlay on this
Go right
one.
ahead because I was
Here's
going to ask you anyways. So.
Here's my plus point. If it's important for you to go back and get your DPT, if that is your goal, the University of Findlay specifically supports PTAs who need to work with faculty who know what a PTA knows, A lot of them have been through the program, not a lot of them, some have been through the program themselves. In a program that has policies that support non-traditional students with 100% first time and all-time pass rates in 2024 cohort with great outcomes. And we're here to support you. We've been here since 1994. We've been accredited since then. So we've got the history of putting out fantastic DPTs that our clinical sites want. Because you go out, not that traditional students aren't fantastic, they are, but nationally, over 2,000 clinical sites that we have know our students and want our students. So that's my shameless plug.
Yeah, I mean, word on the street is you guys were like one of the first bridge programs, if not the first, right?
We were the second.
You were the second.
Second
Okay.
starting, first surviving.
Second starting, first surviving. Gotcha. And
Yeah.
now there are a few other ones out there, but you definitely have
Absolutely.
a lot of people who've went through your program that support how wonderful you've been to students and to help direct their careers down the road. So, okay, who wants to go next? Melissa, Amin, are you going to fight over who gets to go first for their plus point?
Melissa can go.
You're so sweet. Thank you. Oh, goodness. I'm actually going to piggyback off of what Dr. Huber said in that with this non-traditional bridge program, having the support from the professors. I've been to a lot of schools, taken a lot of classes over the last 25 years, and this was the first environment where I felt comfortable calling any of our professors and reaching out and just, if I needed to, saying, I am completely lost with this concept, and them making me feel confident by the time I was done talking with them. And that is in my experience, that is rare. That is very, very rare. And so having the support from the staff, all the instructors, but again, also the cohort, it's a unique experience. And I am so very grateful that I chose this program to be able to go through to get my DPT.
Thank you. Amin, you get to
Yeah,
wrap this up.
it's definitely a unique program, and I completely back Dr. Huber's plug. It is a great program. The professors, the faculty are great. They are supportive of their students, and they let them know that during orientation. Um, Last thing I would say to any PTA thinking about doing this, or any other program, definitely do Findlay. But do what drives you. Do what you're passionate about, because that is going to turn you into that lifelong learner. And that type of person is going to keep growing.
I love it. I don't think I could have come up with a better plus point myself. I wrote down a bunch of words that we repeated over and over again through this podcast, and curiosity was one of them. Discipline, motivation, lifelong learning, time management, and passion. So I think that all of these are areas that if anybody's listening to this show, they should kind of do a quick self assessment or self reflection, right, Angie? And kind of think, are you falling into these categories? Is this something that you want to do? Because if not now, when? I mean, you might as well just go ahead and hit the start button. That's kind of like my theme is just hit the start button and you can kind of figure it out as you go a little bit. But if you check these boxes and you know this is a direction that you want to go, then don't waste any more time and just kind of get on things and get things moving. Angie, can you tell us where students can find more information about University of Findlay's PTA to DPT weekend transition program, bridge program?
Close. It's so confusing. Weekend, PTA to DPT, bridge. It's okay.
Okay,
It took me a while to clarify. Like, this
good.
is
I
the
got
right
all of that
order.
wrong. I didn't get any of it right.
It took me like 5 years of teaching. I got the order right, correct? Anyway, we all get what we're saying, right? So, but yeah, you can look up information on www.findlay.edu, and in the search, just put PTA to DPT, and you'll find all of our info. You can always reach out to me, Huber A at findlay.edu. Admissions at findlay.edu. And we also have Instagram, Facebook, and LinkedIn and I'm not sure about Twitter though. I think we have a Twitter now, but LinkedIn and Instagram and Facebook as well, if you want to just kind of get an idea of the culture. So
awesome. Great. Melissa, Amin, Angie, thank you all so much for your time and effort speaking to me for a little bit of time here this afternoon. I appreciate all of the information that you gave, and I think it's valuable information for the audience and for PTAs out there considering this type of move. So thanks again.
all right, thank you.
Thanks for listening to PTA Plus, the podcast for PTAs by PTAs. Subscribe, follow us on social, and share the show. Elevate yourself. This show is for educational purposes only. No clinical decision making should be made from its content. See you next time.